Hi guys, I'm Trudy. Welcome back to my YouTube channel. Today I want to talk about the different settings that a OT or OTA can work. Also guys, please remember to subscribe to my channel and click the bell so you get notified every time I post a new video. I post a new video every Sunday. Now let's get into the video. Now, the first setting that I want to talk about is hospital. Now, working in a hospital, that's where you have the more acute cases. If you work in a hospital setting, you will be treating more acute cases. For instance, say the patient just had a CVA. You will be providing therapy, and usually therapy is more intense. Sometimes it might be 2 times a day. If you work in a hospital setting, there are different units. Let's say somebody just had a joint replacement, let's say a knee or a hip. So you'll be on the orthopedic floor. And what you focus on might be a little bit different. For instance, let's say a different therapist is on the neurologic floor and she's treating somebody who just had a TBI. Even though you work in a hospital setting, your treatment will be different because you will be dealing with different conditions, a TBI, CVA. And also, you might be also working with the pediatric population. And the focus for therapy is going to be a whole lot different. So it all depends on, let's say, the floor you're working on. If you're working on the pediatric floor, it's going to be different versus if you're working on the orthopedic floor, it's going to be different versus, let's say, the neurologic floor. So if you want to work in a hospital setting, just keep in mind that you're dealing with more acute cases. You know, when the patient just got a stroke or they just come out of surgery after a knee replacement. And also in a hospital setting, these patients are usually not yet stable enough to go home. So also keep that in mind. Another setting is skilled nursing facility or nursing home. That's more subacute. So after they're finished with the hospital, when they get more stable, if they're not able to go home, they usually transfer them to a nursing home. So in the nursing home, you know, they'll still continue therapy. If it was a stroke, they'll still continue with therapy. They might have new goals. There might be communication between the OT from the hospital and the OT from the nursing home. If the patient is not able to communicate his or her goals for therapy, then a family member is usually called upon to give additional information. But in a nursing home setting, that's usually where the patient is more stable. It's stable enough where they don't need that constant monitoring from the doctor. They can, come to the rehab gym and continue their rehabilitation process. And another setting that I want to talk about is outpatient. Let's say the patient did a hip replacement. Not every patient is transferred to a nursing home or subacute after the knee replacement or hip replacement, whatever orthopedic surgery was performed. Some patients, after they get their surgery, they don't go to a subacute nursing home. They go straight home. And these might be some of the patients who get outpatient services. Now, usually the team in the hospital, along with the patient, they'll discuss and pretty much come up with which setting is best. So if the patient is functioning at a higher level, let's say after the surgery, sending them to subacute nursing home might not be the best option. Or the patient might say, I want to go home. They might say, you know what, I have loved ones to care for me at home, or my kid is going to be there, or whoever. But these are usually candidates for outpatient therapy. And like I said, patients who are usually seen in outpatient therapy are usually more higher functioning. And another setting that I want to talk about is, it's kind of like outpatient, but it's a sensory gym. Sensory gyms, for the most part, is tailored for kids on the spectrum of autism. However, kids with various conditions can still benefit from a sensory gym. Even though they might not be on the spectrum, they might still, let's say, have a little gravitational insecurity, or it might just be balance issue or tactile sensitivity, whatever it is. And another setting is home care. Now, let's go back first. Remember, we talked about the hospital setting. So let's say the patient is stable to go home after they did their, let's say, a knee replacement, but they still need additional therapy. That's when home care might come, because for the most part, they're homebound. So that's how home care therapy comes in place. And of course, the team in the hospital, they're the ones who, facilitate that. And also sometimes even after the patient does subacute rehab, that's in the nursing home, they'll still do additional therapy for home care. Of course, you don't just get home care, you have to meet certain requirements. And I believe one of them is you have to be homebound in order to qualify for therapy. And another setting I want to talk about is early intervention. Well, early intervention is really home care, but it's from birth to 3 years old. So it's only for kids, like not even all kids, just from birth, meaning 0 to 3 years old. So usually those kids are the ones that miss certain milestones. The goal of early intervention is really to prevent the child from not functioning to their optimal best. So let's say they're not crawling or they're not creeping at the time that they're supposed to. It is not like, say, they missed, 2 weeks. It's like a big gap from a typically developing child. No. So the goal of early intervention is really to facilitate as much function as possible that is close to the typically developing child. So they don't want the child to really fall behind. The early intervention team collaborates and try to make the child as functional as possible to a typical developing child in terms of all their milestones. And like I said, early intervention is from birth or 0 to 3 years old. After 3 years old, a child no longer qualifies for early intervention. Another setting I want to talk about is mental health. Now, mental health can be in a hospital setting, it can be in a rehab outpatient setting, it can be pretty much anywhere. What some of you might not know is that OT actually started out in mental health. I remember in college, we were having a discussion with our professor. We were asking, why we do so much mental health classes. We want to do, more pediatric classes because at my college, we had more mental health classes than pediatrics. And she said something it was pretty profound. She was like, if we give away mental health, that's really the foundation of OT. So regardless, there might not be as much people want to work in mental health, we still shouldn't give up that part of the profession because that's what really started out the profession. The profession actually started out in mental health. And back then, OTs were called basket weavers. And the last setting that I want to talk about is school. Now, I don't know if you're aware, but OTs also work in a school setting. It doesn't matter if it's a kindergarten school, junior high school, or high school. OTs work in a school setting. Now, the goal for those kids in a school setting is usually tailored for the educational setting. So stuff like writing, how to hold the pencil, different grasp, also how to sit at the table. The goals are usually more tailored to let the child function better in a school setting. If the child is having a problem, staying seated in the classroom, those are the things that OTs usually address in the school setting. Whilst it's affecting the child's ability to perform in the school setting, that's what OTs do in a school setting. Okay guys, that's it for this video. Thanks so much for watching. Please remember to like, comment, and subscribe. And please share this video with someone who you think it might help. Also, click the notification bell so you get notified every time I post a new video. I post a new video every Sunday. Also guys, let me know in the comments if there's a setting that I missed or just anything you want me to talk about. I hope this video was helpful. Thanks so much for watching, and I'll see you in the next one. Also guys, please remember to subscribe to my channel. Help me to get my first 200 subscribers. Thank you so much for helping me get in my first 100. I look forward for you to share my videos so I can get another 100. Thanks guys.